I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. As a doctor, I believe that one of the best aging breakthroughs of the last decade is qualia senolytic, and here's why. As we age, our bodies tend to accumulate senescent cells. Senescent cells are also known as zombie cells because they linger in your body long after their useful function, wasting your energy and nutrition, which can contribute to less energy, slower workout recovery, joint discomfort, and basically feeling old. Qualia senolytic is a clinically tested formula with 9 vegan, non-GMO, gluten-free, plant-derived compounds that help your body naturally eliminate senescent cells, helping you feel years younger in just months. And the best part, you only take qualia senolytic just 2 days a month. It's an easy thing you can do to feel years younger, and it can literally transform how well you age. Go to qualialife.com/lovely to try qualia senolytic. It's backed by a 100-day money-back guarantee, and use promo code LOVELY, all caps, to get 15% off. As always, I'll leave the links in the show notes. That's qualia senolytic at qualialife.com/lovely with the code LOVELY to age amazingly well. Hello, listeners. I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. And this is a solo episode today. I'm just bringing you a little bit of information that I hope will be helpful for you. Many women ask me. All week long in the clinic, I am hearing from women about how their doctor refuses to prescribe them HRT, or they don't know how to ask, or they don't know if they're a candidate for it. And this is a very common conversation that happens in clinic. And of course, I started thinking about the younger generation that's merging into perimenopause now, what we're calling millennial pause, and how we can go about learning what we've learned and making it, I think easier is the right word. Not easier to access, but know when to ask and when and who to ask, basically. And the thought I had recently was, what if all women were offered progesterone at around the age of 40 with their annual physical with the GP? Now, I let this rattle around in my brain for a minute, trying to suss out whether or not there was any risk to doing something like that. And I couldn't come up with one. So we actually know now that the only side effect of natural progesterone is drowsiness. Now, I don't know about you, but I sure embrace drowsiness when it comes. That's after 10 plus years of not sleeping all that well, which was the primary manifestation of my own perimenopause. So perimenopause begins for most women between the ages of 35 and 45. And we start to see the symptoms of perimenopause because of the decline, the slow decline of progesterone. But what if we propped that system up early and we never allowed the symptoms of perimenopause to spool up? What if we spotted the signs of that progesterone decline early and managed it then? Not dissimilar to watching blood pressure or blood sugar. You know, your doctor wants to see your A1C once a year, which is the measure of the average blood sugar over the space of 90 days. And when that starts to tick up, medicine is really good at offering solutions in the form of medications. But can't we apply that same lens to young women in perimenopause? So, what are the signs of progesterone decline? They are, of course, shorter menstrual cycles. So there's less days between your bleed. You might have been 28 days at one point, but now you're more like 24, 25, or 21. We have heavier bleeds and more clotting. We can have headaches and migraines, sleep changes. Now, the sleep change of progesterone isn't typically I can't fall asleep. Low progesterone is typically I can't stay asleep. Now, we really start to see mood changes, and I think this is one of the best places where we can support women's health much earlier than we're used to doing. And it's around these mood changes, specifically depression and anxiety. Now, declining progesterone feels like accelerating anxiety. Now, if you're listening to this episode, I just want you to think about yourself in your late 30s and early 40s. Think about your girlfriends, your family members. Like, I didn't know a single person in that era that wasn't having anxiety that was getting worse. And we have this programming that says if we get anxious or depressed, that's our fault. That like somehow we've neglected to willpower ourselves out of that, which is bananas to think about it. But just one of the other places where we can pull back a curtain and say, actually, that's wrong. That's wrong. There's a biochemical thing going on here. And that's not what we often think about. So we can, with the signs of progesterone decline, the other signs of progesterone decline would be worsening PMS, decreased libido, hair loss, dry skin, dry hair, dry vagina for sure, brain fog and memory issues, and many, many more things. But those are kind of the biggies, all right? Now, remember that estrogen and progesterone work together to create the menstrual cycle. And so estrogen is out there doing its own thing first, but there's good reason why we look to progesterone first in the younger women or the women in the early phases of perimenopause, is because that is likely what's causing the symptoms that you're experiencing that you probably, babe, haven't even connected to perimenopause at this point. Now, hopefully somebody sent you this podcast and said, you know, you better listen to this because I think you should talk to your doctor about this. So we can start to recognize that what's happening with women in late 30s and early 40s is actually hormonal. And I like to think that we should be offering women hormones before we're offering antidepressants or anti-anxiety medications. So to go back to the estrogen to progesterone ratio, we have loads of estrogen typically in early perimenopause. It's quite often fluctuating. It can fluctuate wildly in the space of a short amount of time. All the while, progesterone does a slow decline over years. I say let's treat the cause of these symptoms earlier to diminish disruption of life and encourage health. Now, I'm not talking about synthetic progesterone, which is also called MPA, or progestin-like, is in the IUD or the shot or the birth control pill. I am not talking about that. It is a very different thing than natural progesterone. So if you go to your doctor and your doctor says, here's the pill, or let's put the IUD in. Now listen, if you're heavy bleeding and it's disrupting your life severely, then the IUD with the progestin may make a good sense, okay? So I'm not saying disregard it fully. It's such a personalized thing dependent on symptoms and history. But if your doctor says, well, you're getting progesterone from the IUD, no, you're not. You're getting progestin. And the progestin is the problematic child with progesterone. It is the substance that cause the difficulties of strokes and cancers and blood clots associated with the Women's Health Initiative. Okay? I am not suggesting progestin or synthetic progesterone. I am suggesting natural progesterone, oral micronized progesterone, which is called Prometrium in North America, maybe called that in the UK and Europe as well. I just couldn't find that information. It has distinct properties from the synthetic progestin. It can also be compounded as a cream or a spray or a troche or a capsule, and it is highly bioavailable. That's what I'm talking about. I'm not talking about the synthetics, and I just want to emphasize that because, medicine seems to be really far behind on this one, and we're still prescribing young women birth control pills or women in perimenopause birth control pills. Now, if you need to control your fertility, fine. But if you can look at it separately, if it's a sleep issue, but you've had a tubal or you're not planning on having any more children, then you can consider adding progesterone. So let's talk about how to talk to your doctor about it. Let's talk about stress for a minute. Stress isn't just hard on your mental health, it's also expensive for your biology. If you're dealing with chronic stress, you may want to take a good mineral supplement. Because it turns out when you're constantly stressed, your body burns through a lot more minerals than usual. Chronic daily stress depletes magnesium, potassium, selenium, zinc, and more. Even worse, those mineral deficiencies make future stress hit you harder. If you want to break the cycle of chronic stress, you have to replenish your mineral stores. Minerals make you more resilient to the negative effects of stress, helping you get back on your feet. That's why I love Beam Minerals. Beam makes things easy. You just take a capful of concentrated, mineral-rich liquid each morning. It tastes like water, and it gives you every essential mineral your body needs to deal with the stress in the right ratios with high bioavailability. I've been using Beam for a while now. You'll feel it working within days. You'll have way more energy, and you'll be amazed by the difference it makes for your stress levels. Give Beam a try. Head to beamminerals.com. That's BEAMMINERALS.com and use the code LOVELY for 20% off your first order. Thanks, Beam. First of all, I just want to reiterate that natural micronized progesterone does not cause clots, strokes, cancer, or heart disease, but synthetic progesterone does. I don't think I can say it any clearer. Synthetic progesterone is what's in birth control pill IUD, oral tablets. It is still prescribed commonly. So you have to ask questions. When a woman comes to me and says she can't take HRT because her mother or her aunties or maybe even she had breast cancer, she's just been misinformed. What she can't have is synthetic progesterone or progestin. So what she should say is, I'm high risk, I can't take progestin. Okay, then the answer is to prescribe the natural progesterone, which of course we have plenty of it during our reproductive years. It's absurd to think about us being afraid of it. Okay, so could we prevent many perimenopausal symptoms with early offering of progesterone? I believe so. So if you have symptoms starting, or you're not sure, or you're at a high risk for anxiety, depression, insomnia, etc., ask your prescribing doctor for oral micronized progesterone or Prometrium if you're in North America. It's an old medication. It's been around forever. It is the natural form progesterone. It's available by prescription. It's used commonly for a number of things. And we're just starting to really look at it as an appropriate treatment for the signs and symptoms of early perimenopause. I say get noisy about it. The doctors are not bad, but they were taught in an incomplete system. And so Somebody has to come along, and hopefully it's been done already by this point. But I still hear every single day in my practice, I still hear women saying, my doctor doesn't believe in it. Isn't that interesting? Hormones are a belief system now? Does he not believe in heart disease or cancer? I say piss off with that, but I get a little bit fiery on that one. It's not a belief system, babe. It's hormones. Now, our doctors are just recently being awoken to the idea of lifelong concern for women's health. Previously, it has been focused on childbirth, pregnancy, and menstruation. I know it's crazy to think about, but it's true. Again, there's not bad doctors. There's just incomplete and biased training. Well, there might be bad doctors, but I like to think that we all enter into medicine, whatever form of medicine we do, because we genuinely care and want to help people. So perhaps your line of questioning is the thing that is going to cause the change in thinking for doctors. GPs are pretty busy people. So anyways, okay, so let's offer women hormones before antidepressants and or anti-anxiety medications. We aren't post-useful once we are complete our reproductive era, okay? We will continue to contribute to society, which means we need to take care of women in the hormonal flux of perimenopause, and for most of us, that means some form of hormone support. We know way too much now to leave it alone. These things are protective of brain, mental health, bones, heart, etc. So I am hopeful that this information will be useful for you, will give you new insights to take to your own doctor. And listen, even if you're not 40, even if you're 50 or 55, please take this information to your doctor. So many women endure poor sleep. How the hell are we supposed to hold up society, take care of ourselves, of our kids, of our parents, of our jobs, of our marriages, and our partnerships, our friendships, if we don't sleep every night? We do it because we're strong as hell, but we shouldn't have to. And to me, the solution to this is looking at these things earlier and lovingly saying to yourself, you know what, you could use some help here. And it's totally okay. In fact, it should be the norm. I like to think that my generation, us Gen X gals who are reverent and noisy as hell, are changing things for the younger generations as we move through this. So I embrace that. I hope this has been useful for you. I'm Dr. Fiona Lovely for the Not Your Mother's Menopause podcast. The information and other content provided in this show or in any linked materials is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.